This particular patient had irregular cycles for which a ultrasound was done and incidentally found to have a right side small ureterocele and a left large ureterocele. Initially on cystoscopy, the ureterocele on the right side was not visible, but with patience and a semi-filled bladder, you can elicit the ureterocele. As you can see on the left side, the ureterocele is very big and occupying almost the left half of the bladder. It is of the size of a big size lemon. So in ureterocele, a proper incision will help in giving adequate drainage from that particular side of the kidney. So a smiling incision is usually given, and this incision will open up the ureterocele very nice, and this will help in adequate drainage of the kidney. So incision is usually given at the lower end of the ureterocele, and it is called a smiling incision. So before giving the incision, I prefer to mark my incision with coagulation current. As you see the base of the ureterocele and start marking the incision where you want to use the cutting current. So in this patient, I am using a bipolar Olympus tourist system, and for giving incision, a cutting current is used. As you can see, as I started incising, it is giving a very clean cut. So that is why it is always imperative to mark the site of incision. Once some amount of incision has been given and the ureterocele opens up like that of a frog mouth, as you can see here, you can see the inside of the ureter. And then you can slowly extend the incision. Here I have done the ureteroscopy. After doing a ureteroscopy, the excess fold of the ureterocele should be removed by using a loop. Otherwise, this will act as a flap valve mechanism and start again obstructing. So the fear is to avoid obstruction rather than reflex. So a gentle loop excision will remove the excess flap. Next, we proceed to do the ureterocele incision on the uh, right side. So on the right side, as I said, it is a small ureterocele. So this is the almost final picture on the left side. You can see small chips I am removing. And on the right side, as I said, you need to wait for a couple of minutes with the semi-filled bladder so that the uterus will blow up and it will help you to give a good incision. So trying to manipulate the electric orifice and with again a cutting current bipolar system, a proper incision at the lower end of the ureterocele is given. Very important tip here is to always give incision from the medial side to the lateral side. What happens is this electrode sometimes may inadvertently injure the opposite side ureter. That is why the tips in ureterocele incision are a smiling incision and using cutting current at the base of the ureterocele, avoid creating a flap, and very important is incise from medial to lateral. And once you are happy that your incision is good and there is no flap valve kind of thing, pass a ureteroscope and see if there are any other anomalies that are inside. And then I have placed two stents in each of the two stents on either side of the ureters, and then we can follow up the patient and remove the stents in 4 to 6 weeks of time. So this is all about uterocele incision. Thank you and namaste.